Okay, now we've got an order to DC or discontinue Miss Breed's IV. You're so lucky you get to go home today. Are you excited? Okay, let's get this IV out of you.
Wonderful.
Okay? All right, we're going to put on some gloves for this one. And really all you need to DC an IV is some gloves, some tape, and a 2x2. Most hospitals use a 2x2. So first we're going to take off this tape. If you have trouble getting the transparent dressing off, because obviously this one looks like it's going to come off pretty easily, but if you had trouble getting it off, it's been on for a couple days, you could take as if this was a alcohol swab, and you could just kind of tease the dressing off with alcohol. You just put the end of the alcohol swab there and let it kind of absorb under the skin. The alcohol breaks the adhesive, so it should be pretty easy for it to come off. This one's actually coming off very easily. Okay, now I'm going to take my 2x2 and fold it in half and half again. And rather than exert pressure right now, I want to actually see what this catheter is like when it comes out. So I'm going to gently pull back on it. Are you okay?
Mm-hmm.
You're going to feel a little bit of pressure here. And then as soon as it comes out, I'm going to put pressure on the opening. There we go. Now I'll apply some pressure here, just for 2 or 3 minutes. And I'm going to examine the catheter and make sure that the tip is intact. And that is something that you'll be charting on your nursing documentation, that in fact the tip of the catheter is intact. And we'll be putting that in the sharps momentarily. And I can even ask my patient to help me out here for a second. Could you put your finger there just for a minute? You don't want to get your tape torn in advance and line it up along the railing or anything like that where it's going to pick up pathogens. This actually will be a fine piece of tape. Thanks.
No.
And then I'm just going to pull down, exert a little bit of pressure. Again, if I had gloves that were a perfect fit, that would be a little easier. And then hold a little bit of pressure with your index finger just for a second. It's pretty common if people are in a hurry, they'll DC the IV like so, walk out of the room, and then the call light goes on because the patient starts bleeding a little bit. So if you just take a moment to exert pressure at the time that you DC it, you'll avoid that. And then I usually tell the patient that they should leave that dressing on for about 2 hours and they can take it off when they get home. Then you're going to chart that you discontinued the IV, that it was intact, and that the site looked good. And it does.
Thank you.
Okay.